Today let's talk about resistance in tuberculosis treatment. Now TB is one of the biggest troubling infectious diseases, especially in Southern Africa. One thing about TB is that it spreads easily because it spreads through droplets when people cough or sometimes contact. So what is it that is big about it? One thing nice is it can be cured. Yes, TB can be cured, but you always have to trade in something. And one thing we have had to trade in is that there is high resistance with tuberculosis treatment. And resistance is because there's a lot of stigma around TB because it is usually associated with HIV infection. So for that reason, stigma leads people to seek healthcare very late or to actually default treatment. Now TB is actually treated in a regimen which is time sensitive for 2 months, then 4 months, in some instances even up to 10 months depending on the type of TB. Now because TB has got a cough, not every cough is TB. So always go to the hospital, there's nothing for you to fear. And when you're given a regimen, whatever regimen you're given, always take it to completion. Remember what we spoke about in the last video. When you do not complete the treatment, you lead to resistance. Now the biggest problem we now have is multi-drug resistance tuberculosis, which is resistant to many drugs. And now because of its resistance, it means you have to undergo more cost to test for us to diagnose it and for it to be treated. That is a burden on the healthcare cost and also on yourself and the family. Now make sure you take your treatment to completion. And when you take these drugs, yes, they do come with some side effects, but whenever you think you're suffering from side effects, make sure you see your doctor and they will help you throughout. Do not self-diagnose yourself. Do not default treatment process because of side effects, because you can always get help and be followed up. So what is the little thing you can do today when it comes to TB drugs to avoid resistance? Trust your doctor. Do not self-diagnose. Do not stop treatment for whatever reason. Yes, TB can be cured. And remember, resistance begins when you do the little things. Do your treatment to completion and trust your doctor. Thank you.